Every 30 seconds, someone dies from hepatitis. And most people don't even know they're infected. A virus that quietly enters your body and targets one of your most vital organs, your liver. This is viral hepatitis, a group of infections that cause inflammation of the liver and can lead to severe damage, cancer, and even death. Today, we're uncovering the truth about viral hepatitis. Hepatitis means inflammation of the liver in simple words. But don't let the simple definition fool you. It's far more serious than it sounds. According to the World Health Organization, about 304 million people worldwide live with hepatitis B and C, and every year, approximately 1.3 million people die from this disease. So, is hepatitis just one disease? No. There are 5 types of viral hepatitis: A, B, C, D, and E. All these types damage the liver, but each one spreads differently, acts differently, affects the body differently, and carries different levels of danger. What makes hepatitis dangerous is how similar it looks in the beginning. According to the Centers for Disease Control and Prevention, the signs and symptoms of all types of hepatitis are generally similar. Regardless of the type, most people may experience nausea, fatigue, fever, stomach pain, and loss of appetite. As the disease progresses, more visible signs can appear, and you may notice yellowing of skin and eyes, called jaundice, dark urine, and pale or clay-colored stools. Diarrhea occurs only in hepatitis A infection. In some cases, joint pain and extreme tiredness can take over, but sometimes there are no symptoms at all. Let's look at each type of hepatitis separately. Hepatitis A is caused by the hepatitis A virus. This virus spreads mainly through contaminated food and water, often in places where sanitation and hygiene are poor. The World Health Organization reports that in many developing regions, up to 90% of children get infected before age 10, often without symptoms. According to the CDC, hepatitis A can also spread through certain types of sexual contact, although the primary route remains contaminated food and water. The good news is, it does not become chronic, but it can still make you very sick. So, is that treatable or not? There is no specific antiviral treatment for hepatitis A. Management focuses on supportive care to relieve symptoms and maintain adequate hydration and nutrition. But hepatitis A can be prevented. How? Prevention of hepatitis A is simple and powerful. It can be prevented through safe drinking water, proper sewage disposal within communities, personal hygiene practices such as regular hand washing, and safer sexual practices are also recommended. Several hepatitis A vaccines are available worldwide, but no vaccine is licensed for children younger than 1 year of age. Now, let's move to the most dangerous type of hepatitis, often called the silent killer. Hepatitis B is a far more serious infection caused by the hepatitis B virus. What makes hepatitis B especially dangerous is its ability to become chronic. It can silently stay in your body for years, slowly damages the liver, and eventually puts you at risk of death from cirrhosis and liver cancer. When symptoms appear, serious damage may already be done. Hepatitis B spreads through infected body fluids such as blood, semen, and saliva. The transmission may occur through reuse of contaminated needles and syringes, sharing drug needles, mother-to-child transmission during birth, needle stick injuries in healthcare settings, tattooing, and piercing. Unvaccinated persons with multiple sexual partners are also at high risk of getting hepatitis B during sexual activity. So, what's the scariest part? Let's see that. Unfortunately, there is no specific treatment for acute hepatitis B. However, chronic hepatitis B can be managed with antiviral medications. But the good news is, hepatitis B is preventable. Vaccination is the most effective preventive measure. All babies should receive the hepatitis B vaccine within 24 hours of birth or as soon as possible after birth. Healthcare workers should also be vaccinated. The vaccine protects for at least 20 years and probably for life. Other preventive measures include use of condoms for safe sexual activity, never sharing syringes and needles for injecting drugs, piercing, or tattooing, never recapping a syringe needle, and most importantly, washing hands thoroughly with soap and water after contact with blood or body fluids.
Now let's see hepatitis C.
Hepatitis C is another major global threat, but with a very different story. Like hepatitis B, it spreads through infected blood. Common causes are sharing drug needles, poor sterilization of medical equipment, unscreened blood transfusions, and it can rarely pass from mother to her baby during childbirth or through sexual practices in people with multiple sexual partners. Fortunately, it does not spread through breastfeeding, hugging, kissing, and sharing food or drinks with an infected person. But here's something surprising. Hepatitis C is one of the few chronic viral infections that can actually be cured. The first interferon-free treatment for chronic hepatitis C was approved in November 2013 by the FDA. Soon after this breakthrough, the European Medicines Agency also approved the treatment in January 2014. This unique milestone in modern medicine changed everything, and the cure became possible within 8 to 12 weeks of therapy. Today, HCV is treatable and permanently curable in 95% of people without significant signs and symptoms. But prevention is still better than cure. Currently, there is no vaccine against hepatitis C. Prevention includes safe injections and medical procedures, proper disposal of needles and medical waste, needle exchange programs, substance use counseling, screening of donated blood, and most importantly, practicing safe sex by using barriers such as condoms. Now let's move on to hepatitis D. This one is different. Hepatitis D cannot exist alone. It only infects people who already have hepatitis B, which means hepatitis D infection cannot occur without hepatitis B. This virus is not common, but is classified as carcinogenic to humans by the International Agency for Research on Cancer, which means it can cause cancer just like hepatitis B and C. But the question is, can the medicines treat this infection? New treatments for hepatitis D are emerging, giving hope for better control. In 2023, bulevirtide, a subcutaneous injection, was approved by the European Medicines Agency for treatment of chronic hepatitis D in adults with compensated liver disease. Prevention focuses on reducing hepatitis B transmission. Now let's look at hepatitis E. Hepatitis E virus is shed in the stools of infected people and enters the human body through the oral route from contaminated water. Hepatitis E infection is found worldwide, but is common in low and middle-income countries where access to safe drinking water, sanitation, hygiene, and health services is limited. In most people, it is mild and self-limiting. But in pregnant women, it can become life-threatening. This virus has another dangerous feature. It exists in different variants. It has 4 major genotypes that cause human disease: genotypes 1, 2, 3, and 4. Genotypes 1 and 2 primarily infect humans, whereas genotypes 3 and 4 mainly infect non-human mammals and cause occasional zoonotic disease in humans through consumption of undercooked or raw meat. That means this disease can transmit from animals to humans. Let's have a look at its treatment. There is no specific antiviral treatment for acute hepatitis E. As the disease is usually self-limiting, hospitalization is generally not required. However, people with severe disease, especially pregnant women, may require hospital care. The good news is, prevention is relatively simple. Prevention primarily relies on safe water, sanitation, and hygiene measures. The Hepatitis E vaccine, known as HEV239, also offers hope for vulnerable populations. Viral hepatitis is not just a disease, it's a global health crisis. But there is hope. The World Health Organization Global Health Sector Strategy aims to eliminate viral hepatitis as a public health threat by 2030, with targets including 90% reduction in new infections and 65% reduction in deaths. By sharing this video with others, you can help save lives